Well, in today's video, these are the causes of increased intracranial pressure. Number one is increase in brain volume. This includes cerebral edema. We have cerebral edema. We have things like tumor. We have things like abscess, brain abscess due to infection. We could have blood clots in the brain. We could have things like trauma due to accident, and then we have cerebral spinal fluid dysfunctions or dysregulations. This could happen due to infection, and when there's infection, you find that there's obstruction of cerebral spinal fluid not moving clearly. Things like hydrocephalus, this obstruct the spinal fluids. We have infections such as meningitis or encephalitis, and then we have things like increased blood volume, such as increased cerebral blood flow. If we increase cerebral blood flow, or aneurysm, we have things like venous stenosis, venous stasis. We have also increased central venous pressure. So this can lead to increased cerebral spinal fluid. Other things include idiopathic. This is usually a non intracranial hypertension. Usually we just find that intracranial as hypertension. Other thing is skull deformities, like if you undergo craniosynostosis or congenital disorders. But the most interesting here, we have vitamin A intoxication. If you give a lot of vitamin A, and also tetracycline use. Overusage of tetracycline can lead to increased intracranial pressure. Others include involuntary actions like coughing and vomiting, and even sometimes constipation. But these are just for a short while, and the brain can control them effectively. Well, now let's look at diagnostic or evaluation methods that tends to help you identify that this could be increased intracranial pressure. So this includes a very adequate history taking, that you have to identify what happens if it is a trauma. How did the patient got hit? How did the patient fall? Then you have to do an extensive physical examination, where you have to do mental status examination. You have and be sure that the patient doesn't, or you rule out the neurological deficits like speech, arm movements, and others like pupil examination. You have to look at the details. And then the other thing here, you have to do fundoscopy examination. This is a machine where you put in the eye to look at if there's presence of pupil edema, there is blood stains in the pupil area, and also the pupil examination to see if there are equal reaction, how they react to light and such kind of thing. Then CT will help you to identify if there is enlargement of the ventricles in the brain, and this will show that there is a presence of increased intracranial pressure. So we have to do lumbar puncture, which helps to measure cerebral spinal fluid, and it serves to measure intracranial pressure by using a machine so-called external ventricle drainage machine. And this machine helps to remove excessive cerebral spinal fluid. Also, it measures the intracranial pressure. And usually we all know that we measure intracranial pressure through cerebral perfusion pressure, which is equal to mean arterial pressure minus intracranial pressure. And usually the normal intracranial pressure is 5 up to 15, and any increase above 20 is dangerous, and a quick intervention should be done. So thank you for watching my videos. Please do not forget to subscribe and refer your friends. Stay tuned for another video.